we are going to do one case study video. So that case study topic is medication error case study. Medication error case study. Okay. So there is one patient. Okay. That patient name is Mr. Rakesh. Okay. So the Rakesh age is 52 years. Okay. And now the diagnosis, that means he has hypertension problem and also type 2 diabetes. He's a type 2 diabetes patient, and the doctor prescribed is Dr. Sharma, who is endocrinologist. Okay. Now the prescription, actually this is the prescription. Okay. The prescription they have given is, these are the tablets. You might have seen these tablets outside. Okay. So the tablet is Metformin 500 mg. We have to take one tablet twice a day. And Amlodipine 5 mg. We have to take one tablet once daily. And Glimepiride 1 mg we have to take one tablet before breakfast. Morning we have to take. This is the actual prescription. Okay. Now, there is one more prescription, incident prescription. What it is? The prescription comes to the pharmacist. Na? So, due to the busy schedule of the hospital, the pharmacist has read that Glimepiride 1 mg as Glimepiride 4 mg. Glimepiride 1 mg as Glimepiride 4 mg. Oh my god. See, he have to take only 1 mg. But the pharmacist has given how much mg? 4 mg. So what happened now? The patient consumed wrong dose. The patient has consumed wrong dose. Okay. Now what had happened, that patient, Mr. Rakesh has came the next after 2 days. Mr. Rakesh came after 2 days and he was like symptoms, he felt dizziness, he felt sweating, he felt tremors, and he felt in confusion. And the blood glucose was like 48 mg per dl. And he was like severe hypoglycemia. He got severe hypoglycemia. So now the thing is, what are the root cause analysis? What may be the root cause analysis? Maybe there may be similar packages. There may be high workload to the pharmacist, and it may lead to distraction and also inadequate supervision, that she or she might know about the supervision, and no barcode verified properly. No barcode verified properly. So now, what are the consequences of the error? What had happened to the Mr. Rakesh? It was like severe hypoglycemia, and it is loss of patient trust. Now, the Mr. Rakesh never trusts us. Yes or no? Now, what he required? Emergency treatment he have required, and institutional investigation. Other than those symptoms, what are there? So we have to check it. And now, what you have to do? Immediately you have to give 25% IV injection you have to give, and you have to monitor the diabetes, sugar test you have to do for about 24 hours, and you have to counsel that patient. Oh, Mr. Rakesh, you are well, don't worry, we will take care, you are in observation. Okay, like that you have to tell. Now, what are the preventive strategies? A pharmacist every time should check a proper drug, proper dose, proper time. That pharmacist should check proper strength, and the pharmacist should avoid distractions. Okay, and the system should scan the barcode properly, because 1 mg tablet have one barcode, 4 mg tablet will have proper barcode. So now, these are the discussion questions for you. So you have to discuss all these 5 questions. My first question: what type of medication error has occurred? Second one: how can Lassa drugs be prevented? This is the second question. Third question: which step in dispensing was failed? And the fourth one suggests 2 technological interventions. And your fifth question is that create a safe dispensing flowchart.
Case study video, right? Case study regarding Mr. Rakesh that he had some prescription errors. So regarding the case study, I would like to ask you a few questions. Yeah, Mr. Rakesh, here is your question that what type of medication error has occurred in that case study?
In this case study, the medication error occurred is a dispensing error, specifically a wrong result. The patient, Mr. Rakesh, was prescribed Glimepiride 1 mg. When the trainee pharmacist mistakenly prescribed the Glimepiride 4 mg, and the patient took the medicine for the past 2 days and developed high severe hypoglycemia, and the dizziness, sweating, tremors, and confusion. The root causes inadequate supervision, workload, and distractions, and the absence of barcode verifications. The patient receives 4 dextrose and 24 hours of counseling, and the medication counseling given to avoid this type of errors in future. Thank you.
Thank you so much. That's a great answer. Here is one more question for you. That how can loss of drugs can be prevented in this case study? Can you please state it?
Yeah, sure. First of all, what means for loss of drug error? It means look, say, like, say. Sorry, sound like, say. Means same pronunciation as the word. The mistake for loss of drug error. So how to prevent loss of drug error? Use labeling and double checking is also easy to do, and barcoding, and most important way, pharmacist consult the patient and double check in the prescription.
That's great, Jumara. That's a great answer. Now, one more question for you, my dear. That which step in this dispensing you feel that it's failed?
The dispensing step that failed was verification step. The pharmacist did not verify the pharmacist did not verify the medicine properly and given to the patient. She said the drug was misguided by the pharmacist and given to the patient. This was
Yeah, that's absolutely true. Thank you so much for your answer. Now, here is one more question for you. That can you please suggest 2 technological interventions?
Yeah, so there are 2 technological interventions. By these ways, we can prevent prescription errors. So first one is e-prescription. So what happens in this is the doctor would prescribe his prescriptions in technology, like through the computer, and it goes to the pharmacist. So what the computer system does is it will check the medicine, the dosage, and the drug, and the patient, and next is barcode checking. So what happens here is each medicine has its own barcode. So what happens is when the pharmacist takes Glimepiride 4 mg instead of 1, it would warn the pharmacist that you have taken the wrong drug. So this is how we can prevent it.
That's a great intervention. Thank you so much. Here is one more question for you. That can you create a safe dispensing flowchart or any paragraph?
As she told, her topic was about technical, and I'm going to tell about common use. The pharmacist must triple check the prescription with the computer and the original one, because as our case study, he should check that whether it is Glimepiride 1 mg or Glimepiride 4 mg. And next comes the barcode. The barcode must be scanned properly in the computer whether it is Glimepiride 1 mg.
Thank you so much. Thank you guys.
Thank you.